Let's Talk Nursing is brought to you by bjninform.com, a learning platform for bite-sized, evidence-based content that supports all aspects of nursing. My name is Caroline Vogt, and I'm editor of BJN Inform. In each episode, I talk with experts about different topics affecting nursing practice, including person-centered care, nurse well-being, and career development. In this episode, we explore reflective practice in nursing, what it is, why it matters, and how it can shape both professional development and the quality of patient care. Let's meet our guests.
My name is Helen Ayo-Ajayi. I'm an Associate Professor for Placement, Practice Learning and Innovation at Buckinghamshire New University. I am also a qualified registered paediatric nurse with a qualification in neonatal nurse specialist.
Hello, so my name is Amy Pyle. I'm an adult nursing lecturer at Buckinghamshire New University and I'm a registered nurse.
Hello there, my name is Sunny Daby and I'm a senior lecturer in mental health nursing at Buckinghamshire New University, and I'm dually qualified, both a registered nurse and a mental health nurse by background.
Hello there, I'm Hannah Dunn. I'm one of the senior lecturers at Buckinghamshire New University. I'm also an advanced nurse practitioner.
Why is reflective practice considered an essential part of professional nursing practice?
Obviously within nursing, the environment is so busy and fast-paced a lot of the time. So I think reflection it gives us the opportunity when it's so busy and chaotic and everything's going on that we can kind of slow down a little bit and we can make sense of what kind of has happened, any kind of situation regarding any skills or knowledge or what the situation has been. And I think it then supports to grow and learn and adapt to situations. That's my take on why reflection is really important.
Yeah, I think you're right, Amy. I think, like you say, healthcare can be unpredictable. And sometimes I think, we really experience those ethically challenging clinical environments. And I think that's where reflection comes in. It's, particularly, that critical reflection. And that's really what enhances, our complex thinking, our ethical reasoning as well. So in terms of making those decision-making aspects as a qualified nurse and as a student nurse as well. So I think, like you say, that reflective practice really encourages us to sort of really dive in deep and supporting that sort of person-centered, that sort of holistic care. So yeah, looking at that sort of critical thinking, not just that, our accountability, it's person-centered, more of our ethical practice as well. So really important, I think, for our professional identity as well, like you say, in terms of our environments, which can be unpredictable and really fast-paced.
I also believe that it is essential because it supports self-awareness, ethical practice, emotional resilience, and therapeutic effectiveness. The NMC, the Nursing and Midwifery Council Code of 2018, also embeds reflection within the professional expectations, highlighting its role in prioritizing people, practicing effectively, preserving safety, and maintaining trust generally. So it is a very important component of the nursing practice.
It's also an opportunity for us really to take stock, of what we've done as a professional, because, it is very fast paced, it is very busy. We shouldn't only just be reflecting when things have gone well. Unfortunately, in the nature of the work that we deal with, we do find ourselves where we are, we either make a mistake, not intentionally, but we've got to take stock. It's not just about, okay, I made a mistake and let's move on. It's whether you've made a mistake or we've done it as a collective. Let's take stock, let's stop, and what did we do? What was our actions? What led us to this mistake? At the end of the day, we are human beings, but there's also human factors that take place in there. And was there something that we probably all were, short of and we didn't see that we could have probably been a bit more attentive to? Or is it that actually, what we do is quite task orientated, and these are situations. So again, not also just for ourselves as professionals, but also the accountability that we have to the general public. We are professions who are accountable to the general public, so we also have to demonstrate, when we have done something wrong, we do have to own up and again face those family members and explain to them that this is what the situation has been and we're really truly sorry. and we've learned from it. And again, what have we learned? And I think that's really critical, because at the end of the day, we are caring for people's lives, but we do know that errors do happen. But again, it's showing that as professionals, what are the lessons learned and what would we do differently next time?
Thank you. We've briefly touched on the key purposes and benefits of reflective practice in your introductions, but is there a special definition you would give to reflective practice in the context of nursing that would be slightly different than in other professions?
I think that not any different, and I think we should all be doing this regardless of what profession you're in. So the midwifery are very good, and they've been doing this for many years. Some of what we call the professional nurse advocator. So this is where it's almost like clinical supervision in a sense, and it's an opportunity where people can step out of their environment and speak to a professional nurse advocate. And what that allows for is the role of the professional nurse advocate, which is what I am. We're not there to give you the answers. We're not there to say this is what you should have done, this is what you shouldn't have done. You come, you might have an issue, or a particular thing that has either gone well or hasn't gone well, like we rightly said before, or you're unsure, or you've seen something in practice, or you've seen something your colleagues have demonstrated, and you're not quite sure what to do with that. It's basically a safe space where you can come as an individual, you speak to a professional nurse advocate, and the idea is giving that, it's like a coaching session. So, go back and, you said this, why did you say that? Or why did that happen? Why do you think that happened? So you're kind of asking them questions to kind of broaden their own thinking, broaden their own understanding, to come up with their own solution in effect. So not me giving the solution, but the individual coming in and eventually finding their own solution to the issue that they have presented towards you. And like I said, we in nursing, this is just something that has come out in the last 2 to 3 years, which we're trying to roll out across nationally to get our nurses to become, more reflective and have that more kind of debriefing within, our scope of practice. But like I said, midwifery do this all the time. It's been something that's been part of, and again, maybe because it's a high litigious area where they are dealing with mothers and babies, and so incidences can occur, as that baby losses or even a potential loss of a mother. So they do this regularly, and it's been part of their practice. But I guess this is something that should go not just within nursing and midwifery, for our medics as well as our allied health professionals.
Like Helen says, in terms of examining what went right, what went wrong, etc. But yeah, examining sort of those moral aspects of care, such of autonomy, that dignity, consent, the beneficence to do good for patients. And I suppose it is about exploring those ethical tensions, those dilemmas which we experience, on a daily basis. But particularly where values conflict, maybe patient choice versus safety, or sort of those organisational constraints versus that compassionate care. So it is about, I suppose, reflecting on personal values, emotions, when we talk about reflective, our emotions, and also biases, and how these may be sort of influenced to that ethical decision making. Like Sunny said before, it's embedded in our professional values, our revalidation requirements. So I suppose in terms of reflective practice in the context of nursing, this is looking at our NMC, our ethical frameworks, and embedding it into everything we do, really.
How could you engage in reflective practice in your day-to-day work?
I think, like Helen says, it's bringing it part of it. So for student nurses, it's about embedding it into our practice, whether that's debriefers, whether it's handovers. I think it's about normalizing reflection. It's not about looking at weaknesses. It's about asking questions. What went right? What can we do better? And I think that's so key to that, quality improvements and improving practice. So not necessarily in terms of making it a choice to reflect, but we should embed this into our everyday lives. And not just for nurses, for, like Helen says, all healthcare professionals.
I agree. Sometimes when you say talking about kind of embedding it into like that everyday practice, I find that sometimes we sometimes are scared to approach that reflection. So I find that it's always when a situation has gone wrong, or you're a part of something that has, and sometimes I don't think we give ourselves the opportunity to actually reflect on the good experiences and the good quality care that we've provided and practiced. So I actually do think that it's still something that people do avoid, or sometimes don't realize they're doing it as well, so they're not connecting to it. So yeah,
I'd like to add, I totally concur with what my colleagues have been saying so far, really. So obviously, in terms of looking at the aspect of reflection, there are different ways of perceiving that, really. So obviously, there's one type of reflection where you'll be reflecting while you're doing things in action, and you are capturing that moment in terms of what you're picking up from the person whom you're interacting with, the care you're trying to deliver, and you're picking up on the anxiety and the distresses the person you're interacting with, your patient in this case, is exhibiting, and how you're adapting your responses and how you're working with that particular person. So certainly in terms of reflecting while you're doing something in action is very significant. And looking at the other side of the coin, when you're looking at reflecting on action, for example, once you have already, delivered an aspect of care, and you're going back and you're exploring that experience you've had, and then you're thinking about, what really happened during that time you've spent with that particular person, and what could have been a better approach, what did you learn, what went well, and very much resonating with what other colleagues have already said. But given the fact that we're also constantly getting feedback, could be another means for which facilitates the process of reflection. You might be getting good positive patients feedbacks or carers feedbacks, or you might be getting compliments from them or other team members, or you might also be receiving complaints. On the other hand, there might be incidents which are occurring, there might be near misses, you might be getting reports from audits and quality improvement initiatives and so on, which also allows for the opportunity to be reflecting and gathering, and modifying the ways for which we might be doing things. And therefore, this brings about the link of theory and practice and the policy imbuement into what we do, and understanding why we're doing things in a particular way, where is the evidence coming from, and does it really align to the body we are registered to? So in this case, NMC, and definitely looking at the current ethical and evidence-based approach.
So that leads us on nicely onto actual models of reflective practice. Does anyone want to share any specific models?
There's so many different types of models, isn't there? And there's some that are kind of quite short to kind of explain how to get to that that outcome, and some have different things embedded in them. And I have one that stays with me just because whilst teaching we're actually doing this quite a lot and telling them, which is the role reflection model. So it's kind of like the what, the so what, and the now what. So it kind of is what happened, what was the situation, and then the so what was kind of what links to it. So what was it about it that kind of the knowledge in that and the theory, and then the now what is kind of what from what you've learnt through the what and the so what are you now going to do moving forward. So that's the one that I think sticks quite regularly in my head, and I think it's because I see it quite a bit through that kind of the teaching that we do.
Absolutely, I would quite agree. And Driscoll's model follows on from what you're saying, really. It adopts the three similar stages in terms of what, so what, and now what. And I would like to think that this is a very, very simple model to follow. And obviously, it is very, very useful for people who are beginning to learn about reflection. It is not complex, it's very easily adaptable. And alongside with that, I would also like to mention that Gibbs' reflective model is another one which, a lot of nurses identify with and find this very, very easy to use, although it has 6 stages to that, namely the descriptive factors, the feelings, the evaluative factor, the analysis, the critical factors, and the conclusions and the action plans, paving the way for structuring your learning you get from those situations, basically. And I would also like to say that the models are built up on the level of experience the clinicians would have as well. So certainly what under the model that comes to mind is the Sean's model, which also advocates for, the inaction or on-action learning. And definitely it does, encourage people to be looking at a deeper level of reflection from a more critical approach.
Like you say, the simple models of the what, so what, now what, you can reflect quickly, you can kind of justify your decisions, and then you can kind of translate that reflection sort of into action. I suppose with Gibbs, bringing in that emotion, I suppose that does move beyond that sort of descriptive element. So, and he, with those feelings, you can kind of really sort of gather that, I don't know, maybe you've got moral discomfort or that uncertainty, that distress, really sort of diving into those sort of emotions as such, which is so important, I think, for reflection.
Yeah. And then to support, what Anna's saying, there's also the John's model of reflection, which is similar to the Gibbs. The only, I think, additional piece is, thinking about external factors. So not only looking, yes, you think about your emotions in that piece as well, what your thoughts, what your emotions, what your values, what your morals, but then, what external factors also influenced you. So could it have been your environment? Could have been your peers? So again, you're looking at it from not just only from your emotive point of view, but also looking at it from an external factor, environmental point of view as well. And I guess the ballpark of reflection really is looking at, what is it we're trying to get out here, and what is it we're trying to learn, be it, even when we're looking at our good practices, when we're looking at what we have done well and celebrating those, is what was the good key learning that we can celebrate. It's not just only about when things go wrong, but again, when things are going right and we're doing really well, we should also be thinking that, this was really good. Actually, we should really, we should actually showcase this piece of learning here, because it's quite evident in what we've done. So, yeah.
What are the main barriers that nurses could encounter when they want to carry out reflective practice?
Time. Time. There's no time. Everybody's busy. There's time is a big piece. And like we've all mentioned earlier, where there's different models of reflection, and even in the PNA program, there's also another type of level of reflection. But it is the time and the space you need, because if you really want to reflect effectively and efficiently, you need that time and space to be able to, we also want to we don't want to do it from a superficial level. We also want to go deep down, and to be able to dive deep down in there, we do need space and time to be able to do that.
As I said earlier, I think you can be that barrier. I'm sure my colleagues here have the same experience. You can be very critical of yourself. And I think sometimes that's the importance, where you kind of maybe get some guidance from someone else, as Helen said, about coming in and kind of, working through that reflection with somebody there that's able to support that, because we might not see a positive that's in something that's happened, and just be very negative about it.
Yeah, it's so true, Amy. And I think as well, I think when that reflection sort of involves sort of uncertainty, and like Helen said before, mistakes, or that ethical sort of discomfort, sometimes we can avoid that reflection because of that fear of being judged by peers or managers possibly, and those maybe repercussions sort of linked to errors or those incidents. So I think it's really important to have that sort of safe space, and like you say, that time. There is a lot of pressure in terms of staff shortages, maybe documentation demands, etc. So maybe that's prioritized over that sort of reflective part, so not to be viewed as extra, but maybe bringing that into that integral part of care.
I think additionally, I would like to add, an issue about culture operating in those clinical environments, for example, in those teams. Maybe sometimes there is a concept where efficiency is valued over learning, and a reflection is seen as a soft, non-essential academic task. And there is very, very little role modeling by senior member staff, really. So I think these are some of the issues which also contribute to those barriers which inhibit, reflection from taking place. And definitely there are other things in terms of nurses prioritizing, the needs of the service users, of the patients. So in terms of providing clinical interventions and ensuring the risks are being managed and contained, and that leaving them very little time for facilitation of that process.
Are there realistic ways in which reflective practice can be integrated into a busy clinical environment?
Well, I think reflection doesn't have to be lengthy. It doesn't have to be formal. It doesn't have to be, it can be informal. And it is about that ability to sort of recognise how important it is. So maybe it's that brief reflective element during the handover. What went well? Were there any concerns? What can we do better next time? What could I do differently? And it is about that short pausing, challenging those interactions. So maybe it is in a sort of a huddle, sort of built into maybe at the end of sort of shifts, in terms of those safety checks. So it can be short, it can be really purposeful. So building it into maybe those busy environments, just simple questions, are realistic. It doesn't have to be a full reflective model, but building it in, integrate it into part of our care that we do, part of an end of a shift.
Yes, indeed. I think I would like to say that it is embedded in existing routines. For example, in MDT meeting setups, clinical supervisions of preceptorship meetings, or in post-incident reviews and debriefing sessions and so on. I think those would be very good ways of imbuing that in practice. At the same time, to think about protected time, if possible, so that could be something to think about. And above all, again, it's about the need to be not using any complex models, any simple models which people can easily roll out without any due complexities, mainly looking at what happened and what are the implications and now what sort of situation would take us a long way, really.
I think leaders play a crucial part in this role as well, modeling that sort of reflective behavior and valuing learning over sort of fault finding. So and really protecting those opportunities, that safe space where possible to, discuss and lead to sort of practical changes. And that's what's really going to improve our confidence and ultimately, hopefully, enhance our patient care.
I agree, Hannah. I think you can be that person to share your experiences, and it's really interesting to hear from others and gain insight from their own experiences. And that's a perfect way of kind of, if you come into a situation like that, is remembering what may not have worked or worked for someone else, and then maybe trying that the way that you need to, but you can embed it as well.
Yeah, I think reflection can be so flexible. It can be integrated. It can become part of a normal, sustainable part of our professional nursing practice, even in high-pressured, clinical environments.
Yes, I think it's also very important that we are not being judgmental when colleagues are reflecting and picking on, and things which perhaps reduces the confidence and them being judged as incompetent. And so on. I think that's very important. This is a process for which people should be, developing the confidence and the team support and the resilience to be able to deal with things in a far more effective manner moving forward.
Yeah, I think you're right, Sunny, that sort of shared learning. I think that's going to promote that ethical awareness as well within the team. So, whether it's 5-minute debriefs, that one learning point, maybe those emotional debriefs after distressing events, that kind of reflective element. And that is, like you say, encourages that flexible format for reflection. I think it doesn't have to be written, but it should be purposeful. It should be purposeful for the whole team.
Hannah, you mentioned leadership, and Sunny, you mentioned culture. I guess that brings us maybe to the role of leaders, mentors, or supervisors in supporting reflective practice. How can they work together with nurses to create those safe spaces for honest and constructive reflection?
It is about feeling safe, that sort of safe. You've got a great team that you can discuss and really learn from. And it is about, learning and improving sort of standards. But you've got to be in a safe space for that. You have to have leaders that are, compassionate. It's about ethical leadership, looking at that sort of those moral aspects of care. So I think that's really important in terms of leadership.
Totally agree with what you've said. And I think the nurse leaders, the mentors, or the supervisors even have a pivotal role to play in terms of their practical role in facilitating the reflective practice. And they would be the people who would be creating the safe spaces for honest and constructive reflection. And it's not about the introduction of a particular model. It's not about your ability to be writing, but its ability to be learning and reflecting, and to be looking at a particular issue which may have arisen, and you would be exploring what the issue, that situation provides you as a learning context, and then you would be taking that forward in terms of enhancing your patient's experience, but also your skill sets, and also support for everybody around you.
Helen and Amy, would you like to share something about safe spaces? What is a safe space for you in terms of reflective practice?
I think it's it's being able to either provide a space or be in a space where you can go in, or you can have people come in and reflect and feel that there's no judgment, because at the end of the day, we're all human beings. We see things in different lenses, different views, and we have different opinions. And again, and as individual, different things may can shape us, in terms of our upbringing, our culture, our faith. Also, all sorts of dynamics have a part to play of who we are as an individual, and being able to come in and be able to share in a space where you won't feel judged or looked down upon. I think it's really important that those spaces are there, so people can come in to feel, right, okay, I'm not going to be judged. Here I'm going to be given the opportunity to share my opinion and be supported through that process. And I think that's really, really important.
Yeah, and I don't think, kind of adding what everyone has said, in nursing you spend more time in those environments than you do at home. You're making those relationships with many different individuals, and so for me, a safe space is as soon as you arrive at your workplace, that should be that safe space for you. And as you leave as well, and you go home, that's a safe space. So a safe space for me is somewhere I feel just comfortable and know that there's just support that I can reach out to, and someone that will be able to guide and help.
Would anyone like to share an example of reflective practice that has led to a meaningful change in care or practice?
In terms of sort of my practice in advanced nurse practitioners, we've got GPs, emergency nurse practitioners, and a range of clinicians. So in terms of the huddle at the end of our shift, our cohesive team bringing in that reflective element just for 5 minutes to say, what went well on this shift, what didn't go so well, what can we do to improve. Where, and most importantly as well, what did we do well? What was really good highlight for the day, because it is about staff morale, not just in terms of, like Helen said before, what didn't go so well, but what went well. And I think the task of the day just seemed more meaningful as well. So sort of discussing throughout the team, for us, integrating that reflective element just seems to give that more person-centered approach. So to the care we're providing. So it is about integrating into each shift. Even before we start, is there any concerns? What can we look at today? What went well? What didn't go so well? And really just bouncing ideas off each other. So yeah, just make it an integral part of each shift, really.
How is reflective practice introduced and developed during nurse education?
I'd say constantly, but it's embedded in modules, placements. So the EPADs, for example, when they go out, what criteria they need to meet, they need to build upon their reflections and discuss with educators and practice assessors. So where it kind of is I think it's embedded well. It's whether it's taken on board or whether it's utilised as it's met. So as we want it to be, it's whether it's utilised.
Yeah, I think you're right, Amy. It's that early introduction, isn't it, to that sort of reflection as it's sort of that learning tool, and that is really at the start. So for the students, like learning from experiences, making sure in terms of they're making sense of that theory and relating that to practice. And I suppose that's really important for them to develop their own sort of self-awareness and recognising their own professional identity. So you're right. I think, yes, as soon as they start, and it is about encouraging that reflection, maybe just simple everyday practices, sort of communication with patients, what they're learning in the clinical environment. And it might be that reflection at that stage is descriptive and supportive. You know, this is what gets the students to understand what reflection is and why it matters. So yeah, as soon as they start. And it can be informal, but it is, just that support of reflection right from the beginning.
Okay.
Absolutely. Additionally, I just wanted to say, although they've been taught about this from a theoretical perspective, and they also, are encouraged to be practicing that while they are learning at the university before they start the placement, they're continuously encouraged to be writing the reflections, the reflective diaries, reflective logs in the practice assessment documents, where they are writing short reflections, reflecting on an aspect of care or any situation they might have been involved with, through supervision of, a registered nurse or any other, members of the MDT, in regards to consolidating those learning and taking that forward. So that's happening at every stage of their training, very much to what Amy has mentioned before, and it goes on to the rest of the program, and to build up from there when they become a registered nurse, and then to be moving on to a more deeper context of reflection.
What support can we give newly qualified nurses to help them build confidence in reflective writing or reflective discussion?
For newly qualified, that will sit very much with with their employed organizations where they will be employed. Sunny's mentioned about preceptorship. It will be very key, and it would lend itself, if organizations have a robust preceptorship program for our newly qualified nurses, and again, to support them through that process, because it is a big, yes, they've had placements throughout the 3 years of their program. It's been 50% of the program, but it's not going to be the same as transitioning to a fully fledged registered nurse, where now, yes, they will have a preceptor, they will have a supervisor, they will have a line manager, they'll have a matron, but now you're on your own looking after a patient and the family. You're going to be asked questions. So, and there is also that transition phase of transitioning into a registrant nurse, along with everything else that you've got to learn, and experiences you're going to, and challenges, and the ups and the downs that you're going to face within, adapting into your role. So they should be encouraged to, again, to have that safe space, to especially for them, protected time, because they are going to, yes, everybody's around to support, but we know when it's busy when you're dealing with a situation, and sometimes, for example, I'll give you an example. They say, during your program, you may come across, death. I never came across it. I'm pediatric, but I didn't come across a dead child throughout my entire training. So even though I might have known what to have done, in theory, of how to manage a dying child, or a child that died, I think when in practical terms, I think I would fall into pieces, because I wouldn't have known what to do, how to do that, and it's a lot to take in if you're the lead nurse looking after that patient. You've looked after them for several days or weeks or months, and then they die in your presence. Am I allowed to cry? And if I do cry, how much can I seem to be crying in front of the family? So it is enabling and having that space for those individuals, because it's dealing with their emotions, because we can't say not to cry, because they're human beings at the end of the day. We've got to give them that humanity, but then again, it's right, you're in a working environment. This is going to be our bread and butter, but how do we support them to be able to develop that resilience over a period of time? So it's important that we do create protected learning space for those newly qualified.
I think that's right. Like you say, Helen, I think those trusted relationships are critical for newly qualified nurses. I certainly remember I had a fantastic sort of nurse that really kind of, just cared for me, cared for my emotions, how I was feeling. And like you say, sometimes during your clinical placements, the training. It doesn't expose you to everything, and you are newly qualified. So it is those preceptors who do sort of model that reflective thinking, that gentle questioning, and that gentle judgment. What were you thinking at that point? So I suppose that validation, that uncertainty, and those emotional responses, they are normal, and that's okay. So it is about building that confidence in that reflective element. So, and some, newly qualified nurses, they will worry about reflection. It doesn't mean, that weakness or failure. It is about ensuring that, I suppose, protecting them professionally, building on their confidence. It's not about blame. It's about honest, reflective discussions, really, that expose those emotions, which we learn from.
That's why I think it's really important that it sets a precedent from the start. So when you are, introduced or interview process, you're going to want to find out, is this something they support with, and what do they do to support you through reflection or time. And I think then its introduction period then helps that individual start to feel safe and comfortable. I think it really links back to the environment and the people that are already within it and the culture that's already there. And I think sometimes it's about being confident to speak up as well, if that's not the culture isn't somewhere where it doesn't support or give you time to do that reflection. And for newly qualified going in, you have that imposter syndrome that's already fighting you, and you having to fight back. So I think it's literally from the moment you kind of email and make that application to go somewhere, that's, I think, really important to start from there.
I totally agree with everything you've said so far. I also wanted to say that there is a space for informal check-ins at the end of any particular interventions, end of the shifts, etc. And I think it's also very, very important that our newly qualified nurses get the reassurance that reflection is about learning, not about being criticized. It's about their development, and it's not about them needing to confess about something. It's about them developing their professional insight, and not about over disclosing things they don't feel uncomfortable about. These are the things which probably need to be nurtured, and obviously not to be stuck in a particular model, but to be able to flexibly use the model as a scaffolding process and to adapt that to the context of whatever situation anyone is facing.
If you could share one key takeaway about reflective practice in nursing, what would it be?
The take home will be, as a practitioner, we should always reflect on our practices daily. And, again, it doesn't have to be anything too long or too arduous, but, sometimes when I'm dealing with a student situation, for example, I might have put my foot down a little bit too harsh. But then when I come away from the meeting, I do think, oh, was I a bit harsh, with that student, or and I might go and speak to my colleague, think, oh, do you think I was a bit harsh, or do you think I could have done that stuff? So I guess the art of reflection should be with us, just consciously. It doesn't have to be anything too long. Just thinking about when you sent an email, should you have sent that email? So as practitioners, we should always reflect on everything that we do, and like I said, it doesn't have to be anything too long, but it's just also to keep us in check and to keep us grounded in our profession, our morals, our values and principles.
I suppose in terms of reflective practice, if we embed it, it's going to ensure that our actions are just not only sort of clinically correct, but also ethically justified as well, and legally defensible. I think when reflection is embedded in our practice, then that's really what's going to be a key driver of that sort of safe, that high quality nursing care. So I think that's really important. And certainly in terms of our challenging, sometimes emotionally demanding situation, it's going to be key to supporting our nurses.
For me, I think reflection is the cornerstone of the professional nurse, really. And I think, to be honest with you, it is all about us not thinking about how well we write, how well we are, being critically analyzing a particular situation. It's about thinking about a particular aspect of an episode of care delivery or any situation you might have been in, to learn about that, to think well so that the learning can take place, the compassion and safe care can continue in very challenging situations. And for us, we also need to be thinking about these concepts can be imbued in conversations, not just formalized processes, not about documentations, and for us to be taking every opportunity to be, discharging that aspect of what expected of us as nurses.
We always focus on those difficult or traumatic experiences, and it will be good that people can focus also on the positive experiences that happen and combine, make sure you've got a mixture.
100%. I agree with you, because that is so important to our morale, our professional identities, our amazing nursing workforce.
Thank you for listening to the BJN Inform podcast, and a special thank you to Helen, Hannah, Amy and Sunny for sharing their time and expertise with us. If you enjoyed this episode, you can subscribe to the BJN Inform podcast on your preferred streaming platform so you never miss an episode. You can also listen to the podcast and explore our latest clinical and best practice articles online at bjninform.com. Until next time.